Muy buenos días a todos. Es un placer estar con ustedes en el foro de Tijuana Innovadora. Tijuana es el futuro 2020 y el privilegio de presentar a ustedes a uno de los personajes y seres humanos más extraordinarios que yo haya conocido en mi vida. El doctor Devi Shetty, cirujano cardiovascular, reconocido mundialmente como uno de los mejores y llamado el Henry Ford de la cirugía cardíaca. Ha operado más cirugías en recién nacidos, pediátricos y adultos que ningún cirujano cardiovascular haya operado en su vida. Dr. Shetty ha ganado reconocimientos por ser uno de los médicos más importantes dentro de su país, con los premios que solamente él ha ganado, el primero, segundo y tercer premio a nivel nacional, que se llaman el Padma Shri, el Padma Bhushan y el Padma Vibhushan, del premio civil mérito más alto en la República de la India. No solo es uno de los cirujanos cardiovasculares más renombrados en la India y en otras partes del mundo, sino que también es uno de los empresarios más prominentes de esta era. Por lo tanto, y esto debido a que es fundador y director del sistema de salud Narayana en la India, que empezó en el año 2000 con 300 camas de hospital en Bangalore, India, y posteriormente, actualmente, tiene 17 hospitales, 13 en la nación y 5 fuera del país, incluyendo África, y en otros lugares del mundo, como las islas del Caribe. Dr. Shetty ha sido también nombrado por las academias de Harvard como doctor en medicina honorífico en Harvard, en Minnesota, y presidente emérito de la Sociedad de Cardiología de Estados Unidos. Ha recibido innumerables premios por la economía, por el Economics Time, el Nicky Asham Prize, el Award ICC Lombard por Health Care Award, el Lifetime Achievement Award en la India, The Indian of the Year por CNN e Innovador del Año por El Economista. Y esto sin tenerles que decir más, porque quizá puedan ustedes buscarlo y encontrar todo lo que ha logrado el doctor Shetty. Y no quiero quitar el tiempo de que él nos cuente cómo ha sido la historia tan extraordinaria desde 1993, cuando tuve la fortuna de conocerlo en la India, y desde ese momento quedé impactada con lo que vi en ese hospital, el Birla Heart, en 1993, que tuve a bien venir a operar a Madre Teresa de Calcuta, en la India, en Calcuta, donde él era director de ese gran hospital, el Birla Heart, donde como director me permitió, sin cuestionarme, el que le pedí que por favor me permitiera operar a Madre Teresa, ya que estaba con una insuficiencia cardíaca e insuficiencia coronaria y requería de una segunda intervención que ya se había realizado 3 años antes y en esta ocasión cayó enferma. Sin dudarlo, Dr. Shetty me dio todo el apoyo que necesité en esa ocasión y fue mi apoyo incondicional durante todo el tiempo que permanecí en la India hasta que Madre Teresa recuperó y pudo llegar a su casa y a su hogar, a su convento, con salud y en un estado físico sumamente aceptable. Dr. Shetty, no tengo más que agradecimiento para ti. I have no words to thank you. What you did, those times, difficult times we went through, I remember, but that's an incredible experience that we went together. And I thank you so much for being here. This is a great pleasure for me, a great pleasure for us. This is a present, a big present for Tijuana that you're here in my city, in my country, with us this morning. This morning for us, and this evening for you in India, 12 and a half hours later. We are from remote, from India, and Tijuana, and if we wouldn't have this terrible situation these days with the pandemic of COVID-19, I'm sure you would have been here in presence. And I hope that India is, is coming through all this terrible situation of the illness, and that we all humans succeed soon and become, as we used to, closer together in presence. Shetty, thank you so much for being here. Dr. Shetty, Devi, as I call him. And first of all, we're very curious to know, and I know everybody would be very curious to know, how did you became and decided to be a heart surgeon? How did it happen?
When I was in 5th standard, perhaps 5th or 6th standard, my teacher came to the class and announced that today in South Africa, a surgeon saved some dying man's life by taking away the heart from a dead man and putting it in the patient who needed a new heart. And that is the day I decided that I need to do that job. And I realized that to do that heart operation, I needed to become a doctor. And I said, well, I may as well become a doctor. This is how it started, yes.
And then you trained in England, I understand, in the National Health Hospital in England.
Yes.
In England. Yes. And then
yes.
After that, you were supposed to stay in England, or you were thinking always to come back to India? How was that process? Because everybody is trying to look for excellence and something in achievements in medicine. You could have stayed in Britain and the country, or you could have stayed come back to India. So what did make the decision for you to come back to go back to India?
I always wanted to, I went to England for training and I wanted to come back to my hometown. And my wife was not very happy in England. She was miserable. She wanted to go home. And the kids were growing up. By the time I left England, I had 2 children already. And it was the time for me to go home. But it was a wonderful experience of having had worked at the Guy's Hospital in London, which I definitely feel one of the best training grounds for any young surgeon. Yep.
Fantastic. So once you got into India, I understand you went first to Calcutta. That's where I met you, the Birla Heart?
Yes. Yes.
That's when I met you. And you had been there for not so many years. Exactly.
I think, yeah. Just for a year, I think.
Yes.
Just for a
yes.
Year. Yeah.
And I was amazed because when I stopped and I put foot in this hospital, I could see 2 big wards with lots of, in one ward, full of newborns and children just operated from their hearts. And in another ward, and there were like 10 children, and then in another ward, you have another 10 adults there. And I said, how do you do all these surgeries? And they're all alive and they're all doing well. And they said, well, we do about 4 surgeries at a time. Everybody prepares my surgery, and I just go do the most important steps, and then I go to the other operating room, and then to the other operating room, and this is the way we do. And everybody's trained the same. And the training was extremely strict, and everybody had to do exactly the same steps as you had to do. Yes. And one thing that impacted me was said, how can you do so many surgeries in a hospital in India? You know, the cost. How? They said, you answered to me that it was extremely expensive, and that you wanted to lower the cost of surgery. And I remember this so well. You wanted to lower the cost of surgery because it was so expensive. And if you couldn't convince Mr. Birla to lower the prices, you may have to move on. And I said, how much did this cost? You mentioned $3,500. I just couldn't believe that in India you could perform a first-class complex open heart surgery for $3,500 when in the States it was $150,000. In Mexico, about $25,000 to $30,000, and we thought that we were very inexpensive. And when you told me that, I said, how can you accomplish this? And tell me about how you thought of accomplishing and saying to me that you were wanted and you would lower the prices for India for every single person that needed an open heart surgery could have it done. Tell me about this, Devi.
Patricia, first you have to realize that I live in a country of 1.3 billion people. So if I have to make a difference, I have to reduce the cost, because if a solution is not affordable, it is not a solution. There is no point in we talking about advances in cardiac surgery or a cancer surgery if a common man of my country cannot afford. Now, talking about the children, we produce 26 million babies a year. Wow. Statistically, 1 out of 140 children born anywhere in the world has a heart problem. So that means we produce few thousand children every day with the heart disease.
That's amazing.
So, yeah, our mission is to ensure that every child born in this part of the world has access to safe heart surgery at a price what they can afford. Because we know most of the governments in developing countries cannot spend that kind of money. But we made it happen. But for your information, Patricia, 30 years ago when you came to Bangalore, or when you came to Calcutta to treat mother, what we charge for the patient, now we charge about half of that, 30 years later.
Amazing. But how did you do it? How were you able to do it? Because I see this situation that we live in Mexico the same way, and only the privileged and some few have access to this kind of surgery. And immediately when, at this time of my age, I started thinking I must do something. You started very young, but I'm starting very old thinking, and I must do something for my country, and I must do something in what I do, and I know what to do. And you said, I must ask Shetty this secret, and how did you accomplish it? To give all this care, and how many children and people have you operated since then?
Today, Patricia, we have multiple hospitals. We have about over 20 hospitals, close to 7,000 beds across the country. About 14% of the heart surgery done in India is done by us. So because we do large number of heart operations, we procure materials at a very, very affordable price from all the multinational companies. And because we are the largest buyers, we have the unfair advantage. And also, we build specialized hospital. Like the hospital where I work is only doing cardiac surgery. Similarly, we have a cancer hospital. We have different specialties. So we like to believe in the economy of scale and utilize a maximum utilization of the infrastructure. In India, we work for from early morning till late night, 6 days a week, 6 days a week. Yeah, in the Western countries, people work for 5 days a week. So entire infrastructure, what we have created, the CT scan, MRI, cath lab, everything is lying idle after 5 o'clock. So that is unacceptable. We can't afford to do that. So we pay the same amount of money what you pay for a CT scanner. But we like to do, if possible, at least 50 or 60 CT scans per machine to get the maximum out of it. And that's the only way you can reduce the cost.
Well, I must take all these tips from you, and tell me, but there was something. I remember when you started with your first hospital, the 300-bed hospital, and you told me that you have raised $6 million to start up, And you were a startup, and you won a prize for the startup entrepreneur. And, but also, you requested something to the government of India and to the industry, the medical industry, to give some very small amount. Can you explain how you raised this money by having the industry, medical industry, giving some bonus to your project?
See, that is actually, Patricia, the second second or third hospital we built. We wanted to build a 300-bed hospital with the cardiac surgery and cancer surgery and other facilities for $6 million. That was our target.
Okay.
Now, and we want to build it in 6 months. Normally, it takes about 3 years to build it. And we talked to the medical equipment companies that all of you should park your machines in this building, but we will bring in large number of patients. So we will pay you per patient. It's a very different way of looking at the hospital. Normally in India, we live in a tropical country. I live in a house which is not centrally air conditioned, but hospitals are centrally air conditioned. And central air conditioning costs huge amount of money. And people think central air conditioning prevents infection. But in my experience, central air conditioning is the root cause of most of the infections in the hospital.
Yes.
Best sanitizer for a hospital is the fresh air and sunlight. And we don't allow fresh air and sunlight to come to the hospital. So this is the way we dramatically change the way hospital buildings are built. It's mainly built with prefabricated buildings, materials. So we managed to build it in $6 million, but we couldn't build it in 6 months. We took 9 months because halfway through there was some delay, but it is possible. It is possible.
Incredible. And then you have been involved in many ways with the government, with initiatives and the politics in healthcare in India. And with this, you have compromised the government to come through, to accomplish, to give care, not only to the ones that can afford it, but the poor people, and to have all of them access to good care. And you have instituted even an insurance system that has treated or has access to 3.5 million people in the rural areas. And from that, the government took your example and created another micro insurance system for the poor in India. Tell me about this system and how does it work?
Around 15 years ago, there was drought in the state of Karnataka where I operate, where I am working. So our farmers lost the capacity to buy healthcare. So I talked to my friends who are running hospitals in different parts of the state. And we came up with a health insurance with a premium of 11 cents per month. That is in Indian currency, it is 5 rupees. And that is exactly the amount of money a farmer spends every day to smoke, to buy the local farmers a cigarette called BD. So we told them that one day you don't smoke, and that money for the cigarette you pay for the health insurance, and we will cover you for any operation required. There are about 650 varieties of surgeries done on the human body, and all the surgeries are included, including heart operation, just by paying 11 cents per month. And we launched the insurance scheme through Karnataka state cooperative milk societies. We have a lot of the organized farmers organization called cooperative societies. Mm-hmm. There are millions of members in it. And we convinced them to pay 11 cents per month. And Fortunately, government agreed to become a reinsurer. If we ran out of the money, they said, we will bail you out. And we network with the 400 hospitals across the state. So a patient didn't need to come to my hospital alone. They could have gone to any hospital, but they're all covered. And at the end of 12 years, about 1.3 million farmers had varieties of surgeries. And 130,000 farmers had a heart operation just by paying 11 cents per month. Patricia, poor people in isolation are very weak, but together they are very strong. So I've been trying to convince our government that we have 900 million mobile phone subscribers who are spending about 300 rupees per month just to speak on the mobile phone. So if we can collect 20 rupees from each mobile phone subscriber every month, we can offer health insurance to cover all types of surgeries for 900 million people. It is possible.
Amazing. So you're working on this right now.
I have been working on it for quite some time, but it is difficult to convince. But one day we will get there. One day we will get there.
Yes. Everything that you put your eye in, and I know that you will. Really,
Thank you.
Congratulations. It's fantastic. Tell me about how the time of mother changed something in you or reinforced something within your spirit to be able to accomplish all this? Like she touched every one of us?
Yes. You know, Patricia, it's very interesting. When I was, before all this happened, before you came to Calcutta, mother was unwell and I was operating in BM Birla. And those days there were no mobile phones and I didn't have a mobile phone, and the operating room, the phone started ringing. My anesthetist took the call and a stranger on the other side said, you know, can Dr. Shetty make a house call? And I told the anesthetist that, you know, I'm a surgeon. What do I do visiting patients at home? I don't. Then the caller said, if you make the visit, it may perhaps change your life. But they didn't want to reveal the name of the patient. So I said, all right, I have now plenty of time, so don't mind making the visit. So that is how I landed in mother's place. And I believe that as a doctor, as a scientist, for me to believe anyone with flesh and blood like me and you, it's hard for us to believe they are like God, or they're, you know, they represent, or they're reincarnation of God. But when I met mother, that is exactly how I felt. I felt I'm very close to divinity, and the life has never been the same again. Yeah, I cherish those days, you know, when I could spend some time with her, and I learned a lot of things from her, Patricia. And the most important lesson I learned is the hands that help are holier than the lips that pray. Yeah, yeah, that is really beautiful.
Yes, you do more by giving and service than by being praying, definitely.
Yes.
That's the way mother was, in being with the people that needed her and spending all the time that the poor needed from her. And that's the way the sisters, missionaries of charity, work. And yes, definitely it was an amazing time to be close to mother during all those years. And I'm sure, you know, you had the opportunity to be so much, to be with her so much than I was, even though I was 7 years of my life, privileged life, as a present of God, I had to be mother's doctor. And yes, the same things happened to my mind, and it changed my life, definitely, in reinsuring me and everything that I've done. and I do these days, and how I treat my patients, and how I give my time today. And even though I only treat one at a time, and I can do one at a time, and not millions of you are able to do, and thank God you're able to do it. But I did one thing, and I think that that's the way I treated thousands of people at a time. When I met Mother, and that was reality, and I happened to be so privileged to be invited to see her because she was becoming ill here in Tijuana. And I went to see her, the Bishop of Tijuana, then Excellency Belazaran asked me to come and see Mother. But he told me that if I didn't want to see her, not to go, because she was very ill and a very important person, and he knew that she could die. And if I didn't want to take that risk and that in myself, because, you know, because of my prestige of this or that could be affected, you know, he would understand. Immediately I said, you know, I never even thought of it, you know, I would treat, like you said, I would go and see any other patient, and I did a home visit to mothers here in Tijuana, and I was so amazed. A few moments after I saw her and I started talking to her, I understood the same thing that you did. She's a divine person. She's something that is not totally human. She's beyond heaven and earth. And that's the way I perceived it from the beginning. And it was amazing, all the teaching and all the lessons that I learned in a few words from Mother. But it's true that puts you more into down to earth, and you keep it forever. And all of us have a task after we met Mother. And that's true, and I'm very thankful for that, because it makes all the difference in the world to have a purpose in life. Tell me, I know the system in India is one of the most powerful economic countries in the world. And it's becoming more and more. And I was there, as you said, 30 years ago, or more. And I see India, I was there last year, and I couldn't believe the growth, the economic, the rural areas, people, the way they live now, the happiness in people. They said, how can this 1.5 billion country move the way it moves, and everybody eats, and everybody shares, and everybody gives, and everybody's happy? You know, you don't feel more happiness in any country by seeing and being in India. And this is the way I feel. It really touches my heart every time I go. And, you know, this greatness of India in the growth in their economics, you know, obviously goes to your spirit, your pride, the way people work. They're hardworking people, and they believe in something and working for each other. And, you know, they become such incredible doctors, scientists, all kinds of economists, lawyers. They're well-known people that they run the most important companies in the world. And you see in the United States so many brilliant Indians in the United States, in England, and any other part of the world, even here in Mexico, with big companies. And in medicine, the pharmaceutical industry is just amazing. And we know medicine, the medical industry, is one of the most important economic industries of our time, and it will become the most important. Tell me how India projected, and before it started happening, you were preparing for all this, because now is your time. It's really your time, the India time. Tell me about how this pharmaceutical industries, for such a small amount of money, you can buy a very expensive antibiotic or medication that I was amazed that I had to buy a medication when I was in India this Christmas, past Christmas, and I couldn't believe the cost, you know, and I can go to a pharmacy and they gave it to me and it cost me $1, something that I know here costs $20. How did the industry, pharmaceutical industry, has accomplished this in India?
Patricia, there are many things why India is to some extent standing out, because I strongly believe that India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. And I believe India will do it within the next 5 to 7 years. Because we are privileged to be producing one of the largest number of doctors in the world, one of the largest number of nurses in the world, one of the largest number of medical technicians in the world. It is mainly because of the culture of the family, of the parents investing on the children's education. Mm-hmm. They go through a lot of hardship in educating the children. And also I think it's built on a very strong democratic principles, the country. We have always we had a stable government and the right kind of policies. I think we are privileged, but it will take a long time for us to reach where we want, because we need to take 1.3 billion people together, and it's not easy, but it is happening. We are lucky. We are a privileged country.
Absolutely, but you're very, very smart and intelligent people in India. You have great minds, that's for sure, and great spirit, and that really what drives you on to keep on going the way you're going, and really congratulate your country and all of you for that.
That's a very interesting, Patricia, the culture of a typical Indian mother, when she gives a few chocolates to the kid, she always says that distribute it and eat. She never says you eat it yourself. Uh-huh. She always says share it and eat it. Yeah.
Yes. And that's the way I see how the poor people in the street, I remember seeing how they have a bowl of rice and they will always share to the one that didn't have anything.
Yes.
That was beautiful to see. Even though they were hungry, they would share whatever they have with others in need. And this is the greatness of your country, that spirit that you have of giving and service and love. And that's for sure, with love you can accomplish many, many things. And I see all these doctors coming to train to United States, to England, every other parts of the world, the best universities, Stanford, Harvard, you name it, they're all everywhere. Why they have this eager to learn and become better and better, to come back to your country and work in your country, or to go abroad and stay abroad? Do they come back to your country, all these big minds, or they go away and never come back? You're losing minds, or you're returning your minds to your country?
Most of the kids who go abroad for training, they go for training, they work there, they understand the culture, they understand the principles of business. That opens their eyes. For me, working in England for the NHS has been a different experience. And when I came back, I wanted to do the same thing. Because in a National Health Service of England, whether you are a millionaire or the millionaire chauffeur, you get admitted to the same hospital, same room, share the similar type of beds, and you are treated exactly the same. It doesn't matter how wealthy you are. And that is exactly what I wanted to create. So every time we go out into other countries which have become prosperous, you learn so much. And this is the way most of the youngsters go to Western countries, learn new things, and majority of them come back at some point of time. Yeah.
Yes, that's fantastic. And that's why you have so many brilliant people in investigation and in medicine and sciences, in every single aspect of sciences in the world. And so how do you see, you know, we have so many similarities in Mexico, but I remember when Mother was here in Tijuana, one of the times that she was here, my sister Caroline was lucky enough for Mother to accept an interview, a TV interview, one of the very few, if not the one that she accepted as an interview, the same way we're talking to each other, but presence interview. And she mentioned that she liked and loved Mexico because it reminded her of India, very much so. And this became her second home. Simply in Tijuana, she had 6 houses, and she created the Father's Missionaries of Charity. Instead of being in Calcutta or India or Rome, she started the Father's Missionaries of Charity in Tijuana. And she said that she found that so many similarities between India and Mexico, even in the poorest of the poor. But she could feel the hearts of the people here that sometimes she could not feel it in other countries in the world. So for that, you know, I've seen many similarities. People got a little bit offended at that time with that statement. But if they go and see India the way it is now, they would understand that probably we're us or more poor than India is these days, because we need that push, that spirit, that love, that service to give to others and to be for each other. And that's the way that we can move the whole world. And so it's true. What would you say that is the key for the health system to become better for a country so we can give care for everyone? Because here we have a lot of deficits in our system, in health system, in the country, in the public system. And you know, you have so many keys in how you have accomplished it and have helped the government of India to accomplish this, because you sit in the seat of the governors of the health system in India, I understand. And so what are the recommendations that you could give a country or the politicians or the governments to be able to accomplish healthcare for all the same way for everyone?
It's very interesting. Though I come from one of the largest countries in the world, I learned deeply how the healthcare of Cuba functions. Cuba has a lesson for almost every country in the world in terms of reforming the healthcare. And Cuba trains 6 times more doctors than what Cuba requires. And that is exactly what every country should do. I'm not saying we should train 6 times more doctors. We should train more than enough number of doctors, nurses, and medical technicians. Why we need to train? None of us understand, Patricia, in the next 10 to 11 years, there will be a shortage of 80 million health workforce across the world. There will be severe as the life expectancy increases, as more and more people start celebrating 90th and 100th birthday. Every country will have shortage of doctors, nurses, and technicians. At that time, what the developed countries will do, countries like US and some of the wealthy countries in Europe, they will open their doors for Indian doctors, Mexican doctors, and all the developing country doctors to fly. And we will be in a very bad shape at that time. So when India plans or Mexico plans, what is the number of doctors required? What is the number of technicians required? We have to keep that buffer in terms of what if these countries tomorrow have a problem, because I know none of the countries have plans to build the healthcare manpower what is required 10 years from now, because generally the manpower in healthcare is controlled by medical councils. And it is their interest to keep the shortage so that the salary and our remuneration will always be at a higher level. So it is very important that country like ours must have create a database of what is the current number of doctors are working, how many nurses are working, technicians, and then we have to see how we can develop. Because it takes 14 years to train a surgeon who can operate on your hand, leave alone the heart. So essentially, we have to have adequate manpower. If you do not have adequate manpower, you are not going to have good quality healthcare. Then, of course, my advice to every country, if you want to have a affordable, safe, accessible healthcare, remove the pen and paper from the hands of doctors, nurses, and medical technicians, and give them a digital tool which is smart, which is powered by analytics, which can predict things, give the differential diagnosis, and this can be done without much effort, much cost. If we can do that, we can dramatically change the way healthcare is delivered in your country and in my country. These two things we have to do: manpower and digitization.
And are you training young doctors, or making doctors, or thinking of producing doctors from earlier time in school, in making them think about health programs like this, and direct them and orient it into the medical fields in the different levels? Are you inviting or taking from the rural areas or the less privileged? Are you giving opportunities for them to study and to be specialized, because that's what we need these days?
We have various scholarship programs in different parts of the country, and different names. It has got name like Udan, or in West Bengal it's called Udan. In Karnataka it is the various interesting names we have given. Essentially, we want children, when they are studying in 10th standard, that is about 3 years before joining the professional college, we want brightest kids in 10th standard commit to us that they will become doctors. They should be coming from a poor family, studying in public schools, and they should have the aspiration to become doctors. Then we give them a tiny scholarship every month. Maybe, few hundred rupees we give them. We give the money to the parents so that they don't drag these kids out of school to work in the farm. The moment we give the money to the parents, then the child will become an earning member. It's not a cost center for them anymore. So we mentor these kids. And these kids, some of them are so passionate, they get into medical college by merit. We are a lucky country because we have over 500 medical colleges in the country. So they get into the medical college, and there are kids who are selling trinkets in railway station, in moving trains. Today they have become physicians and surgeons, which is unbelievable. It is very, very important for your country and my country to invest on children from poor families to become doctors. Because these kids have fire in the belly, and they work for 20 hours a day, and they are so passionate. When they finish the training program and they come up, these are the kids with the magic in their fingers, and they can do amazing things in healthcare. But when the medical education becomes expensive, these children stop dreaming of becoming doctors. So that is going to be a disaster, because outstanding doctors across the world with the magic in their fingers generally come from deprived background. These are the children we should invest on.
Absolutely. fantastic. It's a great idea. We should really move on to that in Mexico, think more about it, even though Mexico is very conscious in our universities to bring up people from the rural areas and from distant towns to study in the major universities in Mexico. And they always keep a percentage of these students to be able to get into the positions, which is very good. But probably we need more people to get into medical field, whether they're nurses, whether they're technicians, whether they're doctors, that we need to prepare, and we should bring them from those areas because they're more appreciative than many times the sons or the daughters of very rich people that have everything in their hands from the beginning, and they don't appreciate what they're doing. And many times they're doing because it may be a good business and not because they really want to become the best doctor and give the best to the people that they treat. And that is true. That is true. That is fantastic. And tell me, we have, you also are been working, and I heard that even you came out on Wall Street Journal or something like that about medical tourism in India. You're one of the ones that started kind of moving into this. And let me tell you that Tijuana is the most important city in the country for medical tourism. And not only that, this is the most important city in the world for medical tourism. And sometimes they think that it's Costa Rica, Singapore, India, and many other countries in the world. But to get into medical tourism in your country or in Costa Rica or in Asia, you need to take a plane. And you need to travel for long distance in a plane to get into a place. So you cannot have a hospital in distance from a big city that you cannot get close by to have medical tourism, even if you have the best health system and the most, like you, organized, standardized, best care system. Here in Tijuana, people cross the border, walking. We are next to the most, rich state of the United States, which is California. And since I was a kid, I remember people coming and crossing the border to see doctors for reproductive medicine, to see doctor for alternative medicine, to see doctor for reconstructive surgeries, to see doctor for all kinds of surgeries, general surgery, orthopods, and all kinds of surgeries. And that was something, my parents had a hospital, one of the first few hospitals in Tijuana. So we had this easy relationship, binational relationship with the United States, and people would happily and come happy to Tijuana to be treated. And that's why we never considered medical tourism. For us, it was a natural thing. But now, the name came to medical tourism, which we have always been doing it, and it's the third economic power in our state. And it's really, really important in our state, and we hope that our governors appreciate this, and we push the governors and the people from Tijuana to really build the greatest health system and the most secure medical system in Mexico. And we're working on that, and we hope to do it. But it's true, you have to fly to get to India to do medical tourism, and that's a delay, no? Yes. Shetty, well, I think we could be talking and talking. I haven't seen you in about 20 years since I was with you in India when Mother passed. And that's, I think, the last time I saw you, but I have been in touch through good friends of ours, mutual friends that always tell me how you're doing, and I bet they tell you about how am I doing. But, I really need to follow you and follow your lead, and I'm not a leader, I'm a good follower. So I would like to be your disciple and follow your path. Shetty, Devi, thank you so much for this beautiful interview. And I think you have taught us so much not only to us doctors, but also to all the people, about 3 million people that are watching this program today, and that you will be able to see on later on in recording. But thank you for your visit to Mexico. I hope next time is presential, and we can take you to eat the most fantastic food in Mexico here in Tijuana, as you have in India. And thank you so much, Devi. It's been a great pleasure, and my love. All my love to you and the family and all of us. Please say hello to all the colleagues there that I know.
Sure, I will.
Thank you so much.
Thank you, Patricia. Most grateful.
Same.
Thank you.
Thank you.
Thanks.
Espero que les haya gustado esta entrevista, que me parece que es única. Es un ser humano excepcional, como les dije antes, y debemos reflexionar en todo lo que nos ha dicho en nuestro gobierno, nuestro sistema de salud, también en la industria médica, que es muy poderosa en esta zona del país, y debemos aprovechar estos conocimientos para implementarnos en nuestra zona, Tijuana. Muchas gracias a todos y muy buenos días.